If your back hurts when you're lifting, you've probably heard the old adage, lift with your legs, not with your back. But according to new research, that may not be quite so clear-cut as people once thought. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain why that old adage of lift with your legs, not with your back, may not be quite so accurate, and what you can do to lift safer. So first, let's discuss the research defining this, and then we'll go through some more practical applications of how to lift with correct technique. According to a 2021 research study in Frontiers in Bioengineering and Biomechanics, they studied two different lifting techniques along with just a whatever feels natural to you technique. And they found that a stoop lift like this actually created less compressive forces in your lower back than a squat lift, where you say lift with your legs, not with your back. Now, they also had people just do it their natural way, but we're going to compare that stoop lift, which is typically the way that most people, including most physical therapists, think is bad lifting technique, as well as the squat lift, which most people would classify as good lifting technique. So for the study, they told people for the stoop lift to keep their legs straight, bend at their back, and lift primarily with their back. For the squat lift, they told people to keep their back as straight as possible and lift only with their legs. And what they found is that when you're more vertical, the compressive forces through your spine are actually greater. And that makes sense because if you look at the direction that gravity presses, the compressive forces going through your spine are greater when it's vertical. Conversely, they found with the stoop lift, where you're rounded out like that the compressive forces along the spine were less, but the shear forces going that way were more. Now, there's a caveat to that because they found at L5-S1, the lowest level in the back, that the shear forces were actually greater with the upright squat lift. And let's face it, that's the most common level where people tend to get back problems. So when you're lifting with a perfectly upright spine like this, you've still got to bend somewhere. And so largely you have a very straight spine through the upper lumbar spine, and then right down at the base, you get this really high arch. And that creates a wedge-like shape where that L5 vertebrae will tend to squirt forward. In extreme cases, when you're doing really, really heavy lifting, you can even get a fracture of the vertebrae called a spondylolisthesis, where it'll break and slide forwards. So how do you lift correctly? Well, likely there's a happy medium between getting too much shear force with this rounded stoop lift where you're lifting only with your back, and then this perfectly upright squat lift where you're lifting with your legs. Now, if we look back to an older version of this study done by Kingma et al. In 2004, what they found is that there are some things that are consistent regardless of lifting technique. Obviously, the heavier you lift, the higher the loads are going to be. No matter what technique you use, heavier loads will result in higher forces. Additionally, the lower the object is from the ground or the lower you lift it from. For example, if you lift from down here, it's going to create more compressive force than if you lift higher up because you don't have to bend as far to get it. And then finally, the further away it is from you, the more torque it creates on your spine. So if you have to lift something from out there, it's a lot harder than if you're close to it and it's right underneath of you. So those are variables you can control. But there's likely a happy medium somewhere between that stoop lift like that, where you're completely rounded out and not using your legs very much at all, and then the squat lift where it's completely with your legs. And so if you look at the way that a lot of power lifters do a deadlift, they'll have a bar and they won't squat. It's not like they get down like this and come up like that. Additionally, they don't round their back out and pull all with their back. It's like a triangle so that you have your shoulders, the weight down here, and your hips, and the spine should be relatively neutral, not hyper arched like in a squat lift, and not rounded like in a stoop lift, but neutral, but not upright. So if you think about this triangle, shoulders, hips, and load, you want those all to be in one alignment there. Then as you come up, you want to keep the spine in a neutral position while pushing your hips underneath. So the muscles you're using are your gluteal muscles here, and you're co-contracting your abdominal muscles and back muscles. So you're not doing a back extension type of movement using your lower back muscles. Your abdominal muscles and your lower back muscles are creating like a brace around your spine, and so it's compressing vertically along the spine, but it's not allowing that shear force. So put the hips back, neutral position of the spine, then push the heels through the floor, squeeze your glutes, and drive your hips underneath of you, keeping the spine in a relatively neutral position. So you're not really using your back or your legs, meaning thighs in this case, to lift. You're really lifting with your butt. And so you're coming up like that. If you use a stick on the back just to see the spinal alignment, you're not lifting like this with the squat lift, and you're not lifting like this with the stoop lift, but you're using a happy medium, lifting like that, where the stick stays relatively flat on your back throughout the entire lifting movement. And that applies whether you're doing a deadlift or whether you're just lifting something in everyday life. But again, remember the things that are consistent are the lighter you can get it, the less stress it is on your back. The higher up you can lift it, the less stress it is versus lifting low. And the closer you can get to it, even up on top of it, the better off you are than if you're far away from it trying to lift it out there. So hopefully those tips are helpful to allow you to lift with less stress and less pain in your back. Now, if you need more help for your back pain, I would encourage you to reach out to a physical therapist. And if you're in the St. Louis area, we'd be happy to help you out with that here at More for Life. And no matter where you're watching this video from, if you found it helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.